Shall I start speaking? A very good morning to everybody. First, let me introduce myself. I am Dr. Ruchi Nayar. I'm an orthodontist who's been practicing in the Tri-City since last 18 years now. I did my graduation from Manipal and my post-graduation from KLE Belgaum. And I am passionate about being an orthodontist since I was in 8th class. I chose dentistry because I wanted to be an orthodontist. And why I did so, it's a long story, but I'll try and summarize it and maybe I'll be able to get the message across with my presentation, which I'll start now. Sorry. So, uh, why should one consider their smile? I think the question is quite a lame question in today's world where everybody looks at you and the first thing that they notice is about your smile. A smile is a curve that sets everything right. I think Phyllis Dyer did a very good justification by saying so, where when a mother smiles at the child, she does set everything straight without even uttering a word. Sometimes we communicate so much just with a smile. So, my vision is to sparkle a million smiles in this lifetime. Now, why should anybody consider braces or aligners? Let me show you a few examples to make my point clear. This is a lady who came to me when she was married and she had a daughter who was in probably first class. And she said that it's my brother's wedding the next year. Could I have a better smile till that time? And I said, why not? And this is the smile that we could give her the picture that you see on the right side. Another girl whom I treated way back in 2003, and she was an excellent dancer. She would win all the medals possible for the dancing competitions being held. She was approached by various TV channels because it was not the reality TV shows that could happen at that time. But when they did the screen test, unfortunately, because of the fullness in her face, she was rejected. It really disheartened her and demoralized her mother. They came to me with a very, very big concern. And when I saw them, we did the diagnosis and realized that her problem was not only with her jaws, but also with her teeth. So we did a treatment where we did the jaw treatment as well as we treated the teeth as well. And this is the face that she had finally. Another child where the mandible or the lower jaw was not growing. Because these children came to me at a very young age and the bones were still growing, we could get a drastic improvement in the face, as you can see in the right photograph. Another child who was very happy after completing her braces treatment. This particular girl is a national level hockey player and she was very conscious about her smile, and her peers made a lot of fun of her smile, which was putting her confidence very low. She came to me with a very low self-esteem, and this is the smile that we could give her after the treatment. Her happiness, as you can make out just in the smile, was endless. So let me show you a few conditions that are there when we see people and how we can correct them. If somebody has teeth like this, we could give them a smile like that. Unfortunately, the gap that you see between the upper and the lower teeth is where the tooth has already cracked because the child had something that we call as a deep bite. Sometimes there are some extra teeth which are present which cause crowding between the teeth. And when we remove those extra teeth, we are able to align the other teeth very nicely and give the child a smile like this. The above pictures show the pictures before treatment and the lower ones are after completion of treatment. Sometimes we develop habits which will misalign our teeth or even our jaws. So on the left side, you see pictures before treatment and right side after treatment and the drastic change in between them. Now coming to what are the various types of braces. There are a plethora of braces right from the conventional ones which we call as the metal braces. Here you can notice an elastic around the braces, right? A newer version, a better version, is the self-ligating basis. Here, we do not see an elastic around the braces. So what does it mean for you? Well, when we have traditional braces, we have to put an elastic to hold the wire in its place in the brackets. While in the self-ligating mechanism, as the name suggests, the wire is held on its own with the clip inside the bracket. When we move teeth, the wire has to slide inside the brackets, which produces a lot of friction. This friction is increased approximately 200% times when we put an elastic around it. So when we have to apply a force, let's say of about 400 grams on a traditional tie, 200 or 250 grams, it goes in overcoming this friction, and the net 150 grams does the job. Well, in self-ligating, because of the absence of this particular elastic, the force applies is about 200 grams only, and the friction is much lesser. So what does it mean to you? It means that you have lesser pain, you have lesser discomfort, your braces are much more gentler, and possibly it also reduces some amount of time taken during the braces. If you bother about the metal look, we have something called as the ceramic braces also. These are tooth-colored braces. Though they are not absolutely invisible, they do reduce the likeness of people noticing that you have braces on. A word of caution that I would like to give to anybody who is contemplating having braces or has braces is that you should brush very nicely. See, when we put any bracket on your tooth, the number of surfaces to be cleaned are much more, and you need to take care of all of them. Otherwise, you might develop a bad oral hygiene, bad mouth smell also possibly, and may develop even cavities which are not seen at this stage but will be seen after the removal of these braces. So, there are special brushes which are available to clean on the sides of the braces, and you'll find your orthodontist teaching you how to do that correctly. Now, this comes to our next question, that can we straighten teeth without wires and braces? The answer is yes. Now we have aligners, which are the state of the art technology in controlling our tooth movement digitally. What happens during that, we'll be discussing it a bit later. Coming to how are they different? Well, aligners are transparent, so they are much less visible in the patient's mouth. Even your friend whom you're not changing your aligners in front of will not come to know that you are wearing braces. You remove these braces and you have whatever you want to have. So they become more enjoyable. There are no dietary restrictions as such with aligners. Even your brushing becomes much more comfortable because you can remove these and brush nicely, right? They are much more predictable in our treatment because everything is planned even before we start the treatment, and you are able to see that just before you start the treatment. The treatment time taken is also much lesser as compared to braces. So, how does it start? Well, we start with something called as a digital scan, and like you see on the left side, and then these scans are made to form digital impressions or digital models of your teeth. Now, with the software, we are able to show you within a matter of probably 10 to 15 minutes how your teeth are going to change from the initial position to the final position. That means at this particular point of time, when nothing has been touched on your teeth, you are able to visualize how your teeth are going to be even after treatment. You can discuss with your doctor even the minutest of all details that you would want inculcated in your treatment at this particular stage, and the doctor can design the treatment according to your wishes if it is physically possible. Now, digital dentistry is not limited only to braces. We can even do a smile design or give you a nice $1 million smile depending on how your face is. So, what is done is a scan is done and your photograph of your face is also taken. Now, in that, the different kinds of teeth are placed digitally on your set of teeth and shown to you, and the most matching one can be the final outcome for your teeth, and nothing. Mind you, this is all happening at this consultation appointment. So we can help you get you a better smile with braces or aligners, whatever the case may be. Okay, I will be happy to answer if you have any questions regarding anything that I have spoken about. Okay, I have received a question saying that do braces hurt? Yes, my answer is yes. I had braces myself, and I promised myself that I would never lie to any of my patients when I become an orthodontist. Let me explain this procedure to you. When we put on braces, that time it doesn't hurt. When we put on the wire and the braces, you start feeling a pressure inside your teeth. By that night, the braces will start hurting, and the next 2 days will be quite painful. You might not be able to eat your normal food also. By the third day, the pain comes down. By a week's time, you become absolutely comfortable with it. Now, if you're having braces, you need to come for monthly appointments. So the next 3 weeks go on very comfortably. Then the next time that orthodontist touches your wires or changes them, the entire cycle repeats itself. Nowadays, we do have wires which hurt much lesser than they used to at the time when I had braces. So I always like to use very high quality wires for my patients, and even self-ligating braces make the job much easier for you. I hope I answered the questions. Aligners definitely work much faster because in aligners, what we do is because everything is planned so digitally, we are able to do three-dimensional movements at the same time in most cases. So a regular case where I would say it takes about 1.5 years to complete the treatment, we are able to complete it in the span of 7 to 8 months in case of aligners. Yeah. Uh, no, we do not numb you for braces. Braces are absolutely done, and I personally do take care that whenever I am doing the procedure of putting on the braces, I explain each and every step before doing it to the patient, so they are absolutely comfortable that there is nothing that is going to happen which is going to be unknown to them during the treatment. Uh, well, when we have to see results for Invisalign, what happens is at the scanning stage, that is the first stage when we scan your teeth, at that time itself, within a span of let's say 5 to 10 minutes, there is something called as a simulator, which shows you how your teeth would be after treatment because of the artificial intelligence involved in it. Okay, but the real plan, when we send them all the files to Invisalign and they come back, that's called as a clin check or a treatment plan that comes up, and we share the plan with you, and we tweak it more because we put biology into it, so that the results that come are much more predictable and they stay much longer for you. So yes, you can see the result within a span of 15 minutes. Yeah. Very good question by Mr. Sameer. Uh, the first age to see for braces would actually be at 7 years, because as I showed you the first two cases, that was a problem which was related to the jaws. Now, that is the time when your jaws are growing. And if they are growing in and there's a disproportion in them, we are able to diagnose at that time. And if it need be, we start at that time. Or generally, we start at around 11 to 12 years when the mixed dentition is transitioning, or we are, shedding our milk teeth, and we have the permanent teeth are just coming in. The advantage of doing the treatment at that time is that your muscles get much more adapted to the new position of your teeth. The results are much more stable, and the bone is much more softer. So it's like when you move candles in a cake, it's much easier. But if you have to move the same candles through wood, it will take much more longer time, as in the case of adults. I hope I was able to answer that question. I am going down to see more questions now. 1 second. Okay. I'm not able to see uh, the further questions. Can 1 second. Let me try, please. Okay. Uh, okay. The question is, how long do aligners last, and will teeth reversed after a few years? Yes. After any treatment, whether it's braces or aligners, like we have when you go to a dietitian, you have a maintenance phase. You have to have a maintenance phase even after braces and aligners, which are by the means of retainers. Okay. Now, the latest research says that if we are doing treatment for anybody in the age group of 18 to 20, we should give you retainers, which can again be like aligners only. So totally transparent, very comfortable, and for 1 year it should be a full-time wear. For the next year it should be partial wear at night, and then after that for 3-4 years, depending on the case, as the orthodontist advises you, you need to do it. There are some cases where uh, there are very few cases like where we don't need stability at all, but it's always a good option to go for aligners. When we give stability for retainers, we give retainers not only at the back of the teeth, which do not show at all, but we give them on the front, which are totally invisible also. Yeah. And how long do aligners last? Well, it depends on what is our starting point. If the teeth are too crooked and we have to get to the final position, and it's going to take a lot of aligners to get there, because the amount of movement that is possible in each aligner is about 0.25 millimeters of linear movement, a few degrees of torque, a few degrees of rotation. So that is the limitation of each aligner. So if we have to go from a far position to the final position, is going to take a lot of movements, then the number of aligners will be more. Now, when we discuss the clean check with you, at that point of time only, the digital plan shows you how your teeth are going to move from the initial position to the final position, how many aligners are required for the same, and how much time it will be required to achieve that. Okay, I thank the Unifin team for giving me this opportunity to talk to all of you, and thank you for your active participation. I am really pleasantly surprised, and I hope to talk to you people more often, and I'm able to clarify any doubts that you have. You can contact me at my phone number through the Unifin team anytime. Thank you so much. Have a nice day.